Let's stay with news on the coronavirus pandemic. The latest figures show that nearly 1.5 billion people have contracted COVID-19 in South Africa, and over 51,000 have died because of the virus. Cases have continued to drop compared to the over 20,000 recorded daily earlier this year. However, in the recent days, there's been a slight increase in cases across many provinces. To discuss the importance of closely monitoring these numbers to prevent a resurgence, we're now joined by senior researcher at the CSIR, Dr. Ridwan Suleiman. Dr. Suleiman, a pleasure to have you on the program this afternoon. Let's begin by talking through the latest numbers in terms of confirmed cases. What trends are you noting there?
Good afternoon, Santa. Yes, if we look at the confirmed cases across the country, we have seen it has been steadily declining over the past 8 weeks or so. However, over the course of this week, the number of confirmed cases in South Africa has shown a slight increase. We currently reporting just over 1,100 new cases per day. Now, the slight increase is not drastic, and it's not a sustained increase. It has just been increasing for about 4 to 5 days now, but it is a noticeable change in the trajectory that we saw from the prior 8 weeks. We cannot ignore the fact that we moved to level 1 restrictions just about 2 weeks ago with increased movement and also an increase in gatherings and events. So whether we are starting to see the effects of that change, it's important to monitor. Now, like I said, it is a bit too soon to say whether this is a change, a sustained change in the trend, but managing the pandemic is like running a marathon. Whether the past few days are an indicator of a slight speed bump or whether this is the start of a mountain ahead, we just have to wait and see.
I'd like to expand a bit on a point that you touched on just now. Are we starting to see the effects of South Africa moving to level 1, or is this just a slight hiccup?
Yes, that indeed is quite the pertinent question and something we need to watch closely and monitor over the days ahead. So, like I said, just almost 2 weeks ago, we moved to level 1 restrictions. And we do know that because of the incubation period of the virus, as well as the lag between people showing symptoms, going for testing, and then the reporting of the results thereof, we do have to wait for about 10 to 14 days to see any change in events. So we are now in that window period of 10 to 14 days, and we monitor closely for any change. And the fact that we're seeing a change in the trajectory of the leading indicators, being the number of confirmed cases, as well as the test positivity rate, is an indication that the change in trajectory is a reflection of events 2 weeks ago.
Now, we've also heard from the Health Minister, Dr. Zweli Mkhize, in recent days, where he says that the behavior of South Africans would determine when the third wave could possibly arise. Do these latest numbers support the notion that South Africans are just letting their guard down?
I think we do need to continue we do need to continue to focus on the non-pharmaceutical interventions because that is the only way we're going to manage the pandemic, at least for the remainder of the year. And our behavior and our movement and our compliance to these non-pharmaceutical interventions certainly will have an effect on the number of infections and the rate of transmission that we are seeing. Because this is something that we do need to manage over the next while, I think our behavior and our compliance and mobility and movement and compliance thereof will have an effect on whether we do see a resurgence and whether any resurgence becomes sustained and becomes a wave across the country.
Now, this prospect of a third wave, does it still hold true in the light of the rollout of vaccines being in place currently?
Yes, so vaccinations are one of the important tools that we have to manage the pandemic. However, if you look at the number of vaccination doses administered in South Africa, it's much too low to have any significant effect over the next few months at least. Currently, we've administered just over 145,000 doses to healthcare workers, and this is part of the Johnson & Johnson implementation study. It represents just over 12% of the phase 1 target, or just over 12 in every 100 healthcare workers. Now, as a percentage of the total population, that's less than 0.25% of the total population, and it's not going to have any significant effect, at least for what we're going to see over the winter period. And so the focus still has to be on reducing transmission through non-pharmaceutical interventions. The vaccination tool will only come into play once we vaccinate a significant proportion of the population, which will only happen months later.
Dr. Ridwan, I think it's also important for us to discuss a bit how this research is conducted. Are there any models that can accurately predict when the surge of infections develops and how severe it will be?
Look, there are a number of models out there. I myself had not been looking in any particular projection or models, rather just been tracking the data and looking at the trends in the data. There are a number of models which can predict the number of people susceptible, when there will be an increase, and how severe that will be. However, there are a lot of assumptions and unknowns, and there's a lot of uncertainty in the models. We don't know whether immunity, or those people who have been infected before, whether they will be reinfected or whether the immunity will last. We don't know whether increased transmission will allow for the virus to mutate by replication, and whether any mutations will result in variants that are perhaps again more transmissible or more severe. That's again another unknown. There's so many unknowns in the models that we can't really be certain exactly when any surge will occur, and also what the severity of these surges will be. Every indication is that we will likely see a third wave in infections over the winter period, but again, it's up to our behavior and our compliance to non-pharmaceutical interventions that will influence when that will actually occur, as well as the severity of any resurgence and rise in infections.
Now, as we wrap up, concerns are also remaining about the Easter period, where traditionally you see people travel across provinces, visiting their families and also taking part in large gatherings. Could this develop eventually into mass transmission and development of the next wave?
Indeed, that is the big concern going forward. If we look at the history of the COVID-19 infections in South Africa, just before the Christmas period, we saw increased movement, increased mobility across provinces, as well as an increase in gatherings and a slight sort of complacency, which then led to an increase in infections in the coastal provinces, which then spread inland and across the country, and what we saw in the second wave. So the concern now is whether we will see anything similar now as we move into an Easter period, where we know that there's likely to be increased movement across provinces, and also perhaps increase in gatherings. And so this is the concern. If we don't monitor and watch closely and manage any outbreaks, we could once again see a rise in the transmission rate. And if that rise leads to any variants, any new variants, we could perhaps see something more severe. Again, there's a lot of unknowns, but we do need to bear that in mind, and we do need to watch closely and monitor any resurgence and try to manage that as soon as we see any increase.
Well, that was Ridwan Suleiman, a senior researcher at the Council for Scientific and Industrial Research on South Africa's Central and Premier Scientific Research and Development Organization. That's Dr. Ridwan Suleiman. Well,